So good morning. Welcome to our weekly ACA training. I am going to touch base once again about the North American Conference, partly because I just got some clarification to let you know. I've said before that you can get a 50% off on if you buy the tickets between now and October. See, I'm just picking up randomly throwing out names a month. March. Between now and March 31st, you pick up your ticket. On April 1st, the rates go up. But if you pick them up now, not only will you get it for the less expensive rate, you'll also get, if you tell me that you bought them, you can get it 50% off. So I'm going to quickly show you my screen. And the other thing is a little bit of the details of what that 50% means. So this is where it is. It's at na-insurance.com. If you go there, you'll end up on the main page, and over here on the right, it says conference. Just click that. That'll take you right to the North American Conference where you can get your tickets. They go up April 1st, 50% off if you do it now. It's for all the tickets, whether it's because they let you do a ticket for you as an agent. And if you want to bring your spouse, maybe there's a lot of people whose spouses have kind of ended up joining and then they've become two agents. So they've got that option. You can buy your ticket for $99, which is just your basic. You're going to get your admission, name badge, bingo card, the food. And then if you do the VIP, you get to have all of that. Plus you get the VIP card, sidecar social, the VIP tour of the facility, and another VIP cocktail reception at the Cowboy Club. So you get a little bit more. So right now, buy it for $199, get half off. So you'll get it for $99. So any ticket, whether it's for you or a guest, can do that. The agent must attend the conference. So can't give you your 50% back right away. They want to make sure you're not like borrowing $200 from somebody and then making $100 on them. So you do have to attend to get that back. So you can use it for any of the tickets. Like I said, whether you're bringing it just you or other agents, just let me know. They're keeping a list and we would be really happy to see you. I'll be there. And this is, I don't know, maybe my 6th time going. The first time was one of the ones that I had, honestly, it was probably one of the more influential ones. It was the first one I'd ever been to, and it was insanely kind of, oh my goodness, that aha moment that made me become a better agent. All right, so that's kind of it for that. So today we'll talk about the interpreting the summary of benefits. This is something that as agents, we really need to understand. I see that question all the time in the Facebook groups and stuff, that an agent's asking a question and it's in the summary of benefits. So if as an agent, you don't know how the summary of benefit works, how is your client going to know how it works? And they really should read these. They should get them. My brother Joshua, my agent, he was one of the first ones to notice in the summary of benefits, Molina has this little extra thing that talks about coupons for prescriptions not being applied. Now, the summary of benefits is not an exhaustive list of everything they do and do not cover. They don't even have the exhaustive list. That's why when you call customer service for a health group, what do they say? You can't, basically don't hold us to what we're saying if the paperwork says something different. So even the customer service doesn't necessarily have the exhaustive list, but the summary of benefits is going to show you stuff. And if it's on there, it's pretty cut and dry. So I'm going to share my screen. And it's one of those slideshow things. So, well, now it's being weird. All right, then. It's actually doing what I wanted it to do before. All right, share screen. All right, so summary of benefits. I'm going to show you a couple different ones. Mostly I did this year for my clients because of United Healthcare coming into the realm and people not understanding how that was going to work. So that's what was my reasoning for making kind of a webinar and a PowerPoint. I can send this out to my clients and you can too. So first one, we're going to talk about summary of benefits and the coverage. So sometimes SBC, I never use those acronyms, but I know others have. I try to just say summary of benefits. So on Health Sherpa, I know you can do this on ICHRA too, but Health Sherpa is the one we mostly use. It's got benefits right there next to it. That will take you, the plan details takes you to the details within Health Sherpa, but that benefits will take you to the summary of benefits. And you can also get it here. So if you're doing a side-by-side kind of a comparison of the labs or the ER copay for your client, and they've got more questions, you can go, all right, let's click that summary of benefits. It's right there. Rosalind, your dog is adorable. All right, so summary benefits are typically 6 to 8 pages. The last few pages are not necessarily useful. It will give you more information than those quick plan details that's on Health Sherpa, and it's the true benefits. So regardless of other details, in fact, Health Sherpa quite often will say something that doesn't make sense. Look at the summary of benefits. So pay close attention to limitations, exceptions, and the other important information. All right, page 1, summary benefits. They all look the same. You know, they all have this blue line stripe, group policies, you know, they all have this look. The first one is just telling you the summary of benefits coverage document will help you choose a plan. This one, if it's on the summary of benefits and the carrier doesn't do what it's supposed to do, you have proof that they're not doing what they're supposed to do on certain things. So that's the other reason to really understand this. And it'll have lots of information. A lot of times it's got blue links and they just take you to healthcare.gov for definition. So don't click on those links thinking they're going to take you to more details. It just takes you to the definition of what a deductible is or whatnot. So you'll see the deductible at the top. I'm using the $0 deductible. If it has a prescription deductible, it's right there. $3,000 deductible does not apply to tier 1 and tier 2 meds. And this one in tier 3. Sometimes it'll say if you got a company that's got 5 meds. So it's going to tell you exactly which ones you have to worry about if there's a prescription deductible. Then the out-of-pocket $9,450 for family, and more details of why it matters. Premium, more details. You can use the plan, provider network, stuff like that. It'll walk you down like how much a copay is for a specialist. If there's out-of-network coverage, it's going to be over there, or there's no coverage. With United Healthcare, which is the other reason why we use them, their summary of benefits is a lot more detailed than what you see on that first page in Health Sherpa. On Health Sherpa, it says the labs are $20. It's just a $20 copay. But when you read this, it's a freestanding office $20 copay. If it's at the hospital, it's a $150 copay. Same with X-ray, it's $150 if it's a freestanding, $150 if it's at a hospital. So when your client calls you and goes, you know, I went and got a lab and it says you told me it was gonna be $20 and I got a bill for $150. Now you can see why, because it wasn't billed through a freestanding clinic. It was billed through the hospital. And some hospital systems, you know, they do it at the doctor's office, it's run at the doctor's office. The one in our neck of the woods, nothing gets run through the doctor's office. It gets run through the hospital because then they can get paid more. And you can fight it, you can try, but you're probably not going to win because they're going to go, no, our hospital does all the labs. So this is another reason to read those summary benefits. Freestanding MRI, $250. Hospital, $800. Same situation. Somebody's going, oh, sweet, I can get an MRI for $250. And then they get the bill for $800. Now, $800 for an MRI, don't get me wrong, that's a great copay. MRIs are over $3,000. But if you're getting it because you think you can afford $250 and you get an $800 bill, you're going to be irritated, right? So this is why I encourage my clients to read their summary of benefits. And then this got the prescription stuff. No charge for tier 1s for United Healthcare. Tier 1 was, I don't know, it was not your generics. It was I think condoms were on there, right? It was kind of weird. Who buys condoms at the pharmacy? You know, goes to the pharmacist. And there was a couple other odd things, but it wasn't, tier 1 is not your typical drug, the generic. So really it's the $15 copay. Again, on HealthSherpa, it says no charge for generics. So it's very deceiving to, you know, tier 3, there's your $50 copay. And then tier 4 and 5 is that coinsurance. So remember at the top, when I said, look, the prescription of the drug prescription is $3,000 and it doesn't cover tier 1, 2, and 3. I bet you guys all thought that was generics, brand generics, and then the next level up, you know, but in reality, it's tier 1 is the drugs most people don't even use. Tier 2 is generics. Tier 3 is your, you know, preferred generics. And then 4 and 5 are your typical ones. So you don't want to tell somebody, oh, you can get this, your typical tier 3s for a copay. No, that's in United Healthcare tier 4. There are some carriers, United's not the only one. There's some that have multiple tiers. We have a company, Network Health, that has a tier that's all the free, that they just consider free. So it'll have an insulin in there. It's got some other heart meds and stuff, and that's a different tier. And so you make sure you look at those different tiers. Next one, facility fee. So for your ambulances and surgeons and ER copay, all that stuff will just continue. They're always going to have something on the out of network and in network. The ER copay, always check that out. Does it cover urgent care out of the coverage or not? Facility fee, surgeon, outpatient services. The hospital one is a big one to look at when you have a $0 deductible plan. Some carriers, it's $1,500 per day. Some carry it's $3,000 for stay. Some it's $1,500 per day, but capped at 2 days. So like this one says up to 3 days. So they're going to pay, the copay is $3,000 per day, up to 3 days. After 3 days, the facility fee is covered by the insurance company. Now, that's $9,000. Their max out of pocket is $9,450. Pretty sure the 50% physician fees is going to cover that rest of it. But look at that, because some of the carriers have really nice benefits. We have one that it's a 2-day cap, and that's it. One that says $3,000 per stay. So if you're there for a week, you're capped at $3,000. If you're pregnant, office visits, no charges. If you work with people that are in the age to have children, look at the pregnancy stuff, because there's some carriers that will have really good benefits for pregnancy and the next one won't. Childbirth delivery, $3,000 copay, up to 3 days. And then we have others that have really good benefits, and some it's just deductible. So look at that. Home health care, rehabilitation, habilitative services, skilled nursing, durable medical equipment, and hospice service are listed on here. The durable medical equipment is, I wish there was more detail. That's, if I could have a summary of benefits that was a little bit more, it'd be that. So durable medical equipment is your insulin, so your syringes, all the way up to the oxygen tank, to tubing, to CPAP machines, you know, which is all covered under durable medical equipment. And unfortunately, sometimes you'll see a copay, but is it a copay for the needles? Is it the copay for tubing? Is it, you know, what is it? So that one, they really do have to call the doctor or the hospital or the insurance company, to get what is, especially if it's a copay, what's the copay for tubing or, you know, supplies for their CPAP machine. But all of that would go under durable medical equipment. And then children's eye exam is down here because they have to cover children. They usually don't cover adults. And then this is the excluded services. So that top line will say your plan just generally does not cover, and then it's got a list. So dental care, private nursing, weight loss programs, bariatric surgery, that's where you'll see it. Now, typically, as it says, or generally does not cover, doesn't necessarily mean it will not cover. So talking to your carrier rep is a great thing. So the bariatric surgery, I see that it comes up, you know, you guys are on the Facebook groups, you see it, it gets asked a lot. We have one carrier who, Melina, Nope, it's not happening. Not gonna happen. Don't care what your doctor says. It's not gonna happen. So then I called a different carrier and they were like, well, if it's needed, if the doctor thinks it's medically necessary, okay. So they're implying it will be as long as the doctor does whatever. So you need to talk to your insurance carrier. There are some states that mandate the bariatric surgery. So if you looked on here, that would not be an exclusion. So, and then the abortion stuff started showing up after the rulings. So if somebody wants to know, this is where they can look. We have some carriers that say it just like this, and we have other carriers that it's not excluded. So other covered things that may apply to these services, chiropractic and hearing aids. So if somebody is under 65 and need hearing aids, they should do it now, not wait for Medicare. Because typically once you hit Medicare, it's because you're old. And I don't know, Medicare's like things that they deem as, well, that's because you're old. They just don't cover. So anything with hearing and sexual stuff, they're like, 65-year-olds don't need that. But if they're 30, they can get hearing aids covered pretty well. So if they're losing their loss of hearing due to a medical reason, it covers hearing aids, and it's usually deductible and max out of pocket. Chiropractic is typically a copay. Not always, you can't promise, but it's typically run at the same dollar amount as a regular doctor, but confirm that with your insurance company. And then after that part, it gives you kind of some examples. I don't think they're very good examples, so I tell the clients, don't get hung up on that. They're just trying to tell you how it works. So before I move, any questions on that? Just looking through that. Break it up a bit. All right. So the reason, and also this is the other reason you want to look to see what's the difference between a true HMO and those who are not true HMO. So it may say HMO on your plan, it lists it right there on Health Sherpa. A true HMO, they must have a referral to see a specialist. If that referral is not approved, the carrier is not going to pay it. So they can't just, the doctor's like, yeah, I'll write your referral, and they just go see the podiatrist. They have to wait for the insurance company to approve that. And they must have a primary care doctor assigned to them. I mean, that's where the referrals are coming from. And if they don't get that assigned before they go see their doctor, even for their annual, a true HMO is not going to pay for it. So how do you know if it's a true HMO? So this is United Healthcare. They are a true HMO. Right here, usually the last line on the summary of benefits. Do you need a referral to see a specialist? Yes. The plan will pay some or all of the costs to see a specialist for covered services, but only if you have a referral before seeing the specialist. But then we have Molina. So, this is that line. And then we have Molina. It's an HMO. Do you need to see a referral? No. Can you see a specialist? You can see it without a referral. So don't let HMO scare you. Open up that summary of benefits, and then you can see whether it is or not. And then just let your person know. Typically, a true HMO is less expensive than one that has that lets them go where they want. And it's so they can control the cost. We have clients who are dealing with that right now. United Healthcare, Oscar, whoever has a HMO, it gives them the power to say, no, we don't think you need to go see that specialist. All right. Here's the other thing, comparing. Here's the deductible, and here's what it says on Health Sherpa. So the deductible, $9,400. Before deductible at the ER, full price. Like, wait, what? After the deductible, $500. And I want you to go, wait, that doesn't make sense. You'll see it all the time on Health Sherpa. I think it's because copay and ER just didn't exist and it's not in their programming. I mean, the max out of pocket is $9,400, right? Once you reach that, you're not going to pay anything. That's when you need to look at the summary of benefits, and it'll say it's a $500 copay. So I have to tell my client, I know it says full price on Health Sherpa, but it's a glitch. It's really a $500 copay. Same with this urgent care. Once you've reached your deductible, it's zero. right? Your max out of pocket is 9,400. So if you ever see that where you're like, wait a minute, the max out of pocket and the deductible are the same amount, and it's saying that you have to pay something after deductible, pull up your summary of benefits. You'll also see it sometimes, I got a carrier in a different state where it'll say, and I'm sure you guys have seen this, it'll say $500 / 20% coinsurance. It's like, okay, well, what is it? If you pull up the summary of benefits, often what it'll say is $500 before deductible, 20% after deductible. And that's when the deductible and max are different numbers. So we typically always open the summary of benefits to see the ER, because I also want to tell clients whether they can go to urgent care out of the network. Yes, Mary.
Okay, so you're saying that if someone went to urgent care and they have paid their $9,400, that they will not again have to pay the $40 after that?
Correct. When you reach that max out of pocket, you don't pay anything else.
Because it says after deductible on Health Sherpa, but on the
Correct.
summary of benefits, it's saying and or 0% after deductible.
Right.
Okay.
That's what I'm saying. On that Sherpa, it's a glitch. It's been there for years. It's not Health Sherpa, it's healthcare.gov. There never used to be copays for bronzes for ER. And so for whatever reason, they've never fixed it. It'll say full price and after deductible, and that's just not accurate.
Because it's really confusing, like pregnancy, like
right
for the baby. But so I wonder if you could show one of those. You're probably working off slides, so you can't.
Yeah, I have slides right now.
Okay.
But look at the summary of benefits, because no matter what it says on Sherpa, it's the summary of benefits that's going to be the true answer.
But that's true that some of them, like on the summary of benefits, it will, even if they've made their paid their deductible, they still have to pay a certain amount for the.
Correct. And I'm talking about when the deductible, if you look at my example, the deductible and the max is the same amount.
Got it. Okay. Thank you.
Yes. All right. Same with labs and imaging. You know, I was showing you, it says $20 for this lab, but it could be 20, it could be 150. This is what we do the last week of October. We're just researching and looking at all these plans and trying to see, is there something that we need to know for our clients? You know, this imaging, it's $250, but then, and really it could be $800. Again, $800 is not bad, but I just want my client to know that. Don't expect it to be $250. So that's kind of the summary of benefits in great detail. Is there any questions that anyone has? I figured this could be a short one, kind of going over there. Look at the ones that your most popular plans, if you missed something. The Molina one that I had looked at before, that Joshua looked at, was like, oh, I'd never seen that before. Read the stuff on the side. This is some of the stuff you can do now when you're not necessarily backed, you know, completely back to back with appointments. This is the time to kind of read those. And then when you find one that's like, oh, that's interesting, I've never seen that before, then you'll know to check it next year when the new ones come out, you know. So yes, Virginia.
So just the big takeaway for me, again, so I just looked at I'm just running some comparisons now. So an Ambetter bronze case here in Florida, when I looked it up, it says you do not need a referral for a specialist. And it's an HMO. So that I had no idea. That's the thing. So you go off the summary of benefits, not Health Sherpa.
Yeah.
Oh, that's great.
And it could be an HMO like Molina. They've been an HMO forever, but they don't require referrals to see a specialist.
That's big.
Chris, can I say something?
Sure.
So when I send out the summary of benefits, I've already looked up their doctors and their prescriptions, but I tell them when we do that, look up prescriptions, it's just telling us if it's covered or not. But I tell them on that summary of benefits, the link to the prescription coverage, they can actually pull up the formulary do a F9 and search for their prescription to find out what tier it is.
Yep. We typically look up the tiers, and of course, after a while, you start recognizing every generic, like, generic, 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 generic. But yes, they should be able to see it. They should be able to find it. And if the more and I know some people think, well, if I educate them too much, they won't need me. And I just haven't seen that. You show them how to do this and they're thankful you showed them how. But then they're not necessarily bugging you for all the tiny little things, But if you knew that summary of benefits, the lab one, because that's happened. I mean, people have come up and we're like, what? And then we pulled it up and we're like, oh, I see. Yeah, it's not an incorrect bill. It's just got billed differently than you expected. The urgent care is kind of the big one because every carrier has to cover emergencies out of the network, right? We all know that, but they don't have to cover urgent care. So, which is kind of odd to me because by not covering urgent care, you're encouraging them to go to ER instead of urgent care. But so, when I looked up United Healthcare, we're like, all right, if you're out of the area, you have to go to ER. It'll cover it. Or you can do the virtual. And other carriers that say they'll do a $40 copay, okay, you can go to urgent care and you don't have to worry about being out of network. So
Can I
that
ask
one,
one
I
question?
always look that one up. Yes.
When it comes to if the out of network, so most of these things, if they're out of network, they don't really offer a lot of coverage, right? If you're just out of network, there's not like it's not like corporate America where it's
Only
80.
PPOs offer out of network coverage.
Okay, so all of them. Nobody offers out of network, you pay a lower percentage.
Correct. Unless it's a PPO.
Okay.
And there's a few of them out there. But they also, the thing you have to realize with the PPO is it's two different deductibles. So there's an in-network deductible of, let's just say 5,000. And the PPO that's kind of in our area, their out-of-network deductible is $10,000. And they're not together. They're not happening at the same time. They're two different buckets. So even if I get you this PPO and quote unquote, it's going to cover you out of network, you have a $10,000 deductible to reach before it's going to even pay a percentage. And then its max out of pocket is unlimited. They don't have the rules of the maximum max out of pocket is $9,450, right? The government said that is the most carriers are allowed to charge for max out of pocket, but that's in network. Out of network, there's kind of no rules. The carrier's like, well, we're giving you this benefit, but we get to make the rules. So even if PPOs were like all over the place, I don't know that I would be giving those to people. It's almost better to just pay cash. I mean, what's $10,000? You might as well, you'll probably get a better cash rate going out of network before the insurance even starts paying for some of it. And then there's no max benefit, which means the hospital system is charging whatever they want because it's not a contracted rate. It's better to have cash than to have a PPO. Now, check your summary of benefits. There are some PPOs that will have a max out of pocket. I've seen it $20,000. All right, I guess if you have a major spine surgery and you're getting your whole spine opened up and it's going to be $150,000 surgery, hey, 20,000 is a good deal. But you got to look at that summary of benefits to know if that PPO is actually worth it, because many times it's not. It's not really going to help kick in. See, there's a question. Do you ever use the plan documents to get more details on the services that are not usually covered? Had to do this for a couple seeking infertility treatments. Some cover diseases that causes, but not infertility itself. I have, but pretty much if it's not on there, like infertility, plastic surgery, it's not going to be covered. Now, if it's because of an illness, a disease, they will. I think some of them will cover getting your eggs frozen if you are going to go through chemo and they're saying that or sperm, it's not going to survive. There's a case for that. Not promising, but there's at least a case that, we're doing this because I've got this cancer. A woman who has breast cancer, your plastic surgery if you have to have a mastectomy, they will cover that because that's not really considered plastic surgery. You see this on older folks, but where their eyes are drooping so much that it's blocking their vision. Well, that's a plastic surgeon that goes in and fixes their eyelids. That's covered because it's medically necessary. So some of these, oddball things like bariatric surgery, it's not usually covered. But if there's a case for it being medically necessary, they might cover it. They'll have their own rules and guidelines for that. They may say they need to, pass 7 of these steps before we, as the carrier, deem it medically necessary. But that's kind of the realm of the doctor to prove that. So I don't do too much digging. If it's not on there, if it's those kind of oddball ones, I usually at this point, partly because I've been doing it for so long, but call your carrier reps. That is their job. That's what they're supposed to be helping you with. All right. Any other questions? I think we're done. Nice and short. Thank you very much. Appreciate you popping in this week. And I will see you next week. Hopefully it'll be warm for me. Have a great Thursday, and we'll talk to you next week.